So we go back to the doctor. We go to the emergency room. Well, we called the labor and delivery place and we were like, hey, this is what's up. What do we need to do? And they're like, go to the emergency room. Okay. So we go to the emergency room and they bring me. So also Charlotte hadn't had a bowel movement in like 36 hours. So we were concerned and she was still going through a little bit of jaundice stuff. So Micah was like, well, I want them to look at her too. So when we got to the emergency room, we checked me in and also checked Charlotte in so that she could be checked out. So I was in a room by myself, and then Micah and baby was in a room over there. So it was like I really sucked because I was all by myself. And funny, as soon as a doctor came in to look at Charlotte, her problem with bowel movement was over. She exploded. She blew out her diaper all over her clothes. He just threw those clothes away. Like they checked her jaundice and she was getting better and she was no longer constipated. Like it was all over the place. So she was fine. I got blood drawn and they did, they checked urine and stuff and they put me on an IV and I was in the emergency room for, I don't know, like 6 hours waiting. Finally, they were like, okay, yes, you have an infection. We are going to admit you, but they wanted to admit me back into labor and delivery, but they were waiting for a room. Now I didn't know that because nobody was coming in and talking to me. So I was just hanging out in this room. Eventually, Micah and Charlotte got discharged and they could come into the room with me, which was like, great, good. I finally have somebody in there. And we just hung out. Nobody came in. Nobody said anything. It was like, when am I going to get a room? This sucks. If you've ever spent any time in the emergency room, it sucks. It's the seedy underbelly of the hospital. It's all pretty up there. Emergency room, not nice. No, don't get me wrong. Nurses, peaches, wonderful, nice. It just sucks in the emergency room. Like I was sitting there looking down. I was in a very small room and next to me was a table. And on the base of the table, there was a needle sitting down there. A used needle, I assume. And I was just like, oh my God, I'm going to die down here. But anyway, so finally they're like, hey, we got a room. And I'm like, yes. So like mind you, we got there, we left the house at 11 and got to the hospital about 12. And this was like nearly 6 o'clock, I think. So, and we finally got a room. And they put me on antibiotics, I think. I don't remember. But anyway, we got a room. I don't remember if we did anything that night. I feel like they had to have put me on antibiotics, but I don't really remember. But the next day, they did a CT scan, checked on me tummy to see what was up. And they said, yeah, there's a mass in there. You got an infection. It's like, thank you. I know. And so then they put me on antibiotics for a few days. And that was boring, sitting in a hospital, just waiting until they could do another CT scan. So they did another CT scan, wanted to see if it had gotten better. And they were like, the mass has gotten bigger, but we think what we're going to do is we're going to put some drains. We're going to put some drains in there and try and drain the fluid because maybe the mass is just some fluid. So it's like, okay, cool. The mass is just some fluid. We'll get that out. And then I waited for a few more days. And then I guess a different CT guy, when they were about to go put some drains in, he looked at the CT scan and was like, whoa, no, that ain't going to do anything. She has a hole in there. There's a hole. That's what's causing the infection. Putting some drains is not going to do anything. You need to open that up. You need to take care of that hole. So I was like, okay. So they took me back into surgery. They opened my incisions back up, cleaned it all out, and they did put in some drains and sent me back to my room. And then the doctor came in and was like, so, I'm assuming that what happened is when they sewed her up, the incision that was going this way, the stitches came out. I'm guessing that must be what happened because there's no stitches there and just bacteria is just pouring into her uterus. And so it's like, of course, my husband immediately is like, nope. Nope. You would know if there were stitches that came out. They didn't sew me up to begin with. That's what happened. That's what I think happened. They didn't sew up that thing, and that is what caused all this infection. They also didn't give me any antibiotics when I had infectious stuff in there to begin with, and that is what happened. And they were like, we are now going to send you to Vanderbilt in Nashville because we can't take care of this situation because this is bad. So they transferred me to Vanderbilt. I got to take a really fun ambulance ride. You don't notice how many bumps there are on the road in Nashville until you're in an ambulance with your guts hanging out. Because what they did, and they didn't sew me back up. They opened it up. They cleaned out what they could. They did sew that upright incision. They stitched that back up, and they sewed the very base of the opening up, but otherwise it's open, completely open. And they are doing the wet, where they wet the cheesecloth. It's not cheesecloth. The gauze. They wet the gauze and they pack that into the wound, and then put a big bandage over top of it. So that's what we're doing. And then so like it hurts. It hurts when I'm bouncing. I have an infection in there. I'm in pain. We're bouncing down the highway, having a good time. So we get to Vanderbilt, and they're doing cultures of blood, and they've put me on like 4 or 5 different IV antibiotics because they don't know what I've got. They don't know what the bacteria is. They've got to figure that out, but they just like bombard me with antibiotics. And we sit there for days. We sit there for several days before anything really happens. I'm just on antibiotics in a very small, boring room. But the good news is I'm back in labor and delivery so that Charlotte and Micah can be staying with me the whole time. And then my case was so weird and so complicated that they have like a doctor's meeting on Fridays where like all the doctors come together and they talk about whatever. I don't know. They talked about me. Like they were trying to figure out what to do with me because nobody had seemed to have ever really seen anything like what I had going on. And so they just put me on lots of antibiotics and then took blood. Lots of blood. So I'm pretty much healed up now, but I had so many blood draws, and every like day and a half, my IV would stop working. It would either blow out a vein or it would get a blood clot in it, and they would have to move it. And I had bruises all over my arms. I'll put a picture in here and show you. And I was running out of veins. The only time that I was really scared during this whole process was one of my IV went bad after I had so many of them. And they came in they had to bring in the anesthesiologist with the ultrasounds to find good veins to try and get me an IV. And I had 2 anesthesiologists come in, and they tried like 5 times on each arm, and they couldn't get one. And they couldn't get an IV. And it had been like 3 hours since I was supposed to have my antibiotics, and they left, and nobody came in, and we were like, what do we do? Like I need antibiotics. My husband was like, hey, can you give her oral antibiotics? And they're like, oh, but those wouldn't work as well. And he's like, but they would work a little bit. She's sitting in here without her antibiotics. Guys, do something. And I'm sitting here like, they're not going to do anything. They can't get another IV. I'm going to die. This is going to explode, and I'm going to die. And then this sweet guy comes in. He had actually gotten one of my IVs earlier in the week, and he comes in, he rolls in his little ultrasound, and he's like, I am going to try one time to get you an IV. And I'm like, okay. Now, at this point, because they had poked and prodded me, there was blood everywhere. It looked like a murder scene. There was blood all over my bed. I was in pain. I mean, I'm telling you, it hurt. Like, it hurt so bad. I was in hell. And so he came in, and right up here, which these veins are really deep, so they had to use like really long IV things. He found a vein, he shoved it in, and he said, I got it. I was in tears. I was like, thank you so much. Thank you so much. And he got my IV in, and they could get me my antibiotics, and it was like, oh my God, like pretty much the only thing left to do was to give me a, what is it called? I can't think of what it's called, but it's which I didn't know this would have freaking freaked me out. But it's where they put in an IV that is basically meant to stay there for a long time. And essentially, like, they were going to put it on my chest, which it goes right into your heart. And I had no idea. They had said they were going to put it on my chest. And I was like, what are you hooking it to? I didn't ask because I was like, I don't want to know. But it turns out that they hook it directly into your heart. But the problem is they couldn't do that if I have an active infection, which is like, but I need the antibiotics for the infection, and that's what you need to put in the thingy for. But anyway, but they got me my antibiotics. They had the infectious disease people working on what I had going on, and they finally narrowed it down to what I had. My white blood cell count when I got there was 35. It had gone down to an 11. And so they narrowed it down to what I had, and they put me on, which I was so thankful for, because by the next day, like halfway through the next day, I could tell that this IV was also going bad. And I was like, oh my God, I can't do this anymore. I can't get another IV. I can't. This is just Oh, it was awful. But they came and they said you can take oral antibiotics. And it was like, oh, thank you, God. And so they put me on oral antibiotics. I took those like twice. And then they were like, guess what? You get to go home. And I was like, yay, I get to go home. However, I've only been taking these antibiotics for like a half day. Are we sure? Are we sure we can go home? I don't want to come back here. Are we good? I guess we were good. Because they finally sent me home. And I was so happy to go home. And we got out of there at like 5 o'clock Sunday. And they showed my husband how to dress my wounds and gave me the medications that I needed and sent me on the merry way. And I did get home, and I had like a 99 most of the time now. A fever that they're concerned about is anything that's 100.4 or higher. So 99 is fine. But I had a 99 for most of the first week. And one time I had a 100.3. And Mike is like, oh my God. And I'm like, oh my God. And he's like, do you want to go in? And I said, no. It is a 100.3. It is not a 100.4. And that was the only time that I had that. And then it went back down to the 99. And then eventually, after about the first week, it went to normal, 98.7, 98.6. I still get a 99 every now and then. And what I'm dealing with is I have that open wound, and my husband is packing it with the wet gauze twice a day. And I'm taking my antibiotics, and I'm still on my blood thinners. And yeah, we are surviving. I have no idea how long it's going to take for this to heal. I can't do much of anything. I can take care of the baby, and I can do some stuff around the house, but like my parents and my husband are taking care of the pigs and the chickens and anything that needs to be done outside. I'm not driving. I'm not doing nothing. I'm just chilling, which is fine. I can work on some things that I want. I'm reading. I'm reading books. I'm doing cross stitch. I'm spending lots of time hanging out with baby, and that's really nice. I can just hang out with baby all day, and I don't have to worry about a whole lot now. And it's really nice to be taking care of baby, because during that 2 weeks right after she was born, I couldn't take care of baby. I didn't change diapers. I didn't clean. I didn't change her clothes. I couldn't nurse for a while because of the antibiotics that I was on. They were making her stomach upset. So Micah was doing everything. He was feeding her, and he was doing everything. So it's really nice that now I'm doing diapers and changing and cleaning and nursing, and I'm doing all the things for baby now. But he was Mr. Mom. Like, he deserves an award. He was taking care of me and baby, and he's amazing. I couldn't do it without him, and I couldn't do it without my in-laws taking care of everything while we were away. And when we got back, they had fixed us dinner, clean the house. They come over every day and check on me, and if I need anything. And my mother-in-law, she comes and she hangs out with me for a few hours, and they take care of the animals. And yeah, I've just got like a support system. I do not know how a woman would do this. Like, this is not a common thing to happen. But that's what we've got. And I have a support system that is just, it's a gift from God, because I couldn't do this without them. And yeah, so that is what we are. That's what I'm dealing with. That's what I've been dealing with. And yeah, so if you made it to this point in this long story, thank you. I don't know how much I'll be posting or anything. I'm just surviving. I'm just surviving. But little Charlotte is doing great. She's healthy. She's up. She was born at 7 pounds, 9.3 ounces, and she is now at 9 pounds. She's in the 50th percentile, and she's doing great. I have an appointment on the 3rd to go get my wound checked out. And yeah, so hopefully we have good news there. It's just been, it's been a rough month for me. This is, like I said, this did not go to plan at all. But anyway, yeah, so that's what's been going on. Thank you guys for watching.